Today, we're opening up about men's health, specifically erectile dysfunction. ED is common and nothing to be ashamed of. Talking about it is the first step to better health, stronger relationships, and confidence. Let's start the conversation and put your health first. So, what exactly is erectile dysfunction? Let's break it down in simple terms. ED is when a man has consistent trouble getting or keeping an erection that is firm enough for sex. It is important to understand the word consistent. Almost every man will have trouble with an erection at some point in his life. Stress, tiredness, or drinking too much alcohol can cause a temporary problem. That is perfectly normal. We are talking about a problem that happens over and over again. It is a persistent issue that starts to interfere with your life and your relationship. An erection is a complex process. It involves your brain, hormones, emotions, nerves, muscles, and blood vessels. It all starts with a signal from your brain. This signal travels down your nerves to the penis. It tells the blood vessels to relax and open up, which allows more blood to flow in. This increased blood flow is what makes the penis firm. Erectile dysfunction happens when something disrupts this process. It could be a problem with the nerve signals. It could be an issue with blood flow. It could even be a psychological block that gets in the way. It's also important to know that ED can look different for different men. For some, the main problem is getting an erection in the first place. For others, they might be able to get an erection, but it doesn't last long enough for satisfying sex. And for another group, their erections might just not be as firm as they used to be. All of these scenarios fall under the definition of erectile dysfunction. The key is that it is a recurring pattern, not just a one-time event. Understanding this helps you recognize if what you are experiencing is something you should talk to a doctor about. Remember, ED is a medical condition. It is not a reflection of your masculinity or your desire for your partner. It is a physical or psychological issue that has real treatable causes. Millions of men of all ages experience it. In fact, studies show that about 30 million men in the United States are affected. The numbers go up as men get older, but it is not just an old man's problem. It can affect men in their 40s, 30s, or even their 20s. Recognizing it for what it is, a health issue, is the first step toward finding a solution. Erectile dysfunction is much more than just a physical issue. It reaches deep into a man's emotional and psychological well-being. When a man struggles with ED, it can trigger a storm of negative feelings. He might feel frustrated, angry, or disappointed in himself. A sense of failure can creep in, making him feel less of a man. This can lead to a serious blow to his self-esteem and confidence, not just in the bedroom, but in other areas of his life as well. The stress of not being able to perform can create a cycle of anxiety, where the fear of failure itself becomes a cause of ED. This emotional impact doesn't just affect the man, it has a ripple effect on his relationships. Intimacy is a vital part of a romantic partnership, and when sexual intimacy becomes difficult, it can create distance. A man might start to avoid physical contact altogether, fearing that it will lead to an expectation he can't meet. His partner may feel confused, rejected, or even think they are no longer attractive. This can lead to a breakdown in communication and emotional connection. Both partners can end up feeling isolated and hurt, often because the real issue, ED, is not being discussed openly. Furthermore, ED can be a powerful indicator of your overall health. Think of it as your body's check engine light. An erection depends on healthy blood flow and nerve function. When these systems are not working correctly in the penis, it is often a sign that they might not be working correctly elsewhere in the body. ED is frequently one of the earliest signs of underlying health problems like heart disease, clogged arteries, high blood pressure, or diabetes. In this way, paying attention to ED is not just about your sex life, it is about protecting your heart and your future health. Because of this strong link between ED, emotional health, and physical health, it is crucial to address the problem holistically. Simply taking a pill might help with the physical symptom, but it may not resolve the underlying anxiety or the relationship stress. It also won't fix the potential heart condition that could be causing the issue in the first place. That is why a comprehensive approach is so important. We need to look at the whole person, mind, body, and relationships, to truly find lasting solutions and restore not just sexual function, but overall well-being and happiness. Erectile dysfunction can feel isolating, but you're far from alone. Over 30 million men in the US experience ED, and by age 40 to 70, more than half of men are affected. It's not just older men. Up to 1 in 4 seeking help are under 40. Knowing these numbers can empower you to seek help and realize you're not alone. There are many myths about erectile dysfunction, causing anxiety and confusion. ED isn't just psychological. Most cases have a physical cause, like blood flow or hormones. It's not about attraction or love, and it's not just a normal part of aging. Most cases are treatable, with options from lifestyle changes to medication, so don't let myths hold you back. To truly understand what goes wrong in erectile dysfunction, it helps to first understand how a normal, healthy erection works. It might seem simple from the outside, but it is actually a beautifully complex and coordinated event involving your brain, nerves, hormones, and blood vessels. Think of it as a chain of command, where every link must be strong for the final result to happen. It all starts in your brain. When you experience physical or mental sexual arousal, your brain sends out powerful chemical messages. These messages are the starting pistol for the entire process. These nerve signals travel from your brain down the spinal cord and out through a network of nerves to the penis. This is the communication step. These nerves tell the muscles in the walls of the arteries in the penis to relax. This is a crucial step. Normally these arteries are somewhat constricted, limiting blood flow. When the muscles relax, the arteries widen significantly. This allows a rush of blood to flow into 2 sponge-like chambers of tissue that run along the length of the penis, called the corpora cavernosa. This is the filling stage of the erection. As blood rushes into the corpora cavernosa, these spongy tissues expand and become firm, much like a balloon being filled with water. This rapid inflow of blood is what causes the penis to become erect and rigid. At the same time, this swelling and pressure squeezes the veins that normally drain blood away from the penis. This traps the blood inside, which is what sustains the erection. For as long as you are aroused and the signals from the brain continue, this state is maintained. The erection is firm because blood is flowing in faster than it can flow out. When sexual stimulation ends or after ejaculation, the process reverses. The brain stops sending the arousal signals. The muscles in the artery walls tighten up again, reducing the blood flow into the penis. At the same time, the veins that were squeezed shut now open up, allowing the trapped blood to flow back out into the body. The penis then returns to its soft, non-erect state. Understanding this sequence, brain signal, nerve communication, artery relaxation, blood inflow, and blood trapping, helps us see all the different points where a problem can occur and lead to erectile dysfunction. Erectile dysfunction is not a one-size-fits-all condition. It can show up in different ways and with varying levels of severity. Understanding the nuances can help you better identify what you are experiencing and communicate it more clearly to your doctor. We can generally categorize ED by its cause, either organic or psychogenic. Organic ED is the most common type and refers to dysfunction caused by a physical problem. This could be related to issues with blood vessels, vascular, nerves, neurogenic or hormonal. For example, atherosclerosis, which is clogged arteries, is a vascular cause, while nerve damage from diabetes is a neurogenic cause. On the other hand, psychogenic ED stems from psychological or emotional issues. This includes things like performance anxiety, stress, depression, guilt, or relationship problems. Sometimes a man might have one bad experience and then the fear of it happening again becomes a self-fulfilling prophecy. A key sign of psychogenic ED is the ability to get firm erections in other situations, such as during sleep, nocturnal erections, or upon waking, morning erections, but not during attempts at sexual intimacy with a partner. This shows that the physical machinery is working fine, but a mental block is getting in the way. It is also very common for men to have a mix of both organic and psychogenic causes. A man might start with a mild physical issue that makes getting an erection slightly more difficult. This initial difficulty can then trigger performance anxiety, which adds a psychological layer on top of the physical one. This creates a vicious cycle where the physical problem fuels the anxiety, and the anxiety makes the physical problem even worse. This mixed-type ED is very common, and it is why a comprehensive treatment plan that addresses both the body and the mind is often the most effective approach. Beyond the type, ED is also described by its degree of severity, mild, moderate, or complete. A man with mild ED might find that he can usually get an erection sufficient for sex, but not always. His erections might also be less firm than they used to be. A man with moderate ED has more consistent trouble. He is frequently unable to achieve an erection firm enough for penetration, and a man with complete or severe ED is consistently unable to get an erection at all. Identifying where you fall on this spectrum is an important step in the diagnostic process and helps your doctor tailor the right treatment for you. Many men wonder about the link between aging and erectile dysfunction. While ED becomes more common with age, it's not age itself but health conditions like high blood pressure and diabetes that are the real culprits. The good news? Managing your health and staying active can greatly reduce your risk and improve symptoms. Erectile dysfunction is often a sign of an underlying physical health issue, especially in men over 50. Blood flow, nerve signals, and hormones all play a role. Conditions like heart disease, diabetes, or low testosterone can disrupt this balance. That's why a thorough medical checkup is the first step. Erectile dysfunction is often the first sign of vascular disease because the arteries to the penis are so small. Treating ED isn't just about sex, it's about protecting your heart. If you notice ED, talk to your doctor. It could be a critical warning for your heart health. Healthy habits that improve your heart will also improve your erections and your life. Your daily choices and habits have a profound impact on your ability to get and maintain an erection. Many of the risk factors for vascular disease, which we know is a leading cause of erectile dysfunction, are directly tied to your lifestyle. Making poor choices day after day can slowly damage your blood vessels and nerves, setting the stage for problems in the bedroom. On the other hand, adopting healthy habits can not only prevent erectile dysfunction, but can often help reverse it. This puts a tremendous amount of power back into your own hands. You have the ability to influence your erectile health through the choices you make every single day. Let's start with smoking. Smoking is one of the worst things you can do for your erectile health. The chemicals in cigarette smoke directly damage the lining of your blood vessels, making them narrow and less flexible. It accelerates the process of atherosclerosis, restricting blood flow all over your body. It is a direct cause of vascular disease and therefore a direct cause of erectile dysfunction. The good news is that quitting can make a big difference. Many men who quit smoking notice a significant improvement in their erection quality as their blood vessels begin to heal and blood flow improves. What you eat and how much you move also play a star role. A diet high in processed foods, unhealthy fats, sugar and salt contributes to high cholesterol, high blood pressure, obesity, and diabetes, all major causes of erectile dysfunction. In contrast, a heart-healthy diet, like the Mediterranean diet rich in fruits, vegetables, whole grains, and healthy fats, helps keep your arteries clear and your blood flowing smoothly. Regular exercise works wonders too. It improves circulation, helps you maintain a healthy weight, lowers blood pressure, and reduces stress. Even something as simple as a brisk 30-minute walk each day can significantly improve your vascular health. Finally, do not underestimate the impact of alcohol and lack of sleep. While a single drink might help you relax, chronic heavy drinking can damage your liver, interfere with your nerves, and lower your testosterone levels, all of which contribute to erectile dysfunction. It can also act as a depressant, dampening arousal. Similarly, poor sleep can disrupt your hormone levels, including testosterone, and increase stress, creating a perfect storm for erectile problems. Prioritizing healthy habits is not just about general well-being, it is a direct investment in your sexual health and vitality for the long term. While physical problems are the cause of erectile dysfunction in most cases, we can never ignore the powerful connection between the mind and the body. Psychological factors can be the primary cause of erectile dysfunction, especially in younger men, or they can be a secondary factor that makes an existing physical problem much worse. The brain is the command center for sexual arousal, and if it is preoccupied with stress, anxiety, or depression, it cannot send the clear signals needed to start an erection. This is what we call psychogenic erectile dysfunction, and it is just as real and valid as erectile dysfunction caused by a physical condition. Performance anxiety is perhaps the most common psychological cause. It often starts with a single instance of being unable to get or keep an erection, maybe due to fatigue or too much alcohol. This single event can plant a seed of doubt. The next time you are in a sexual situation, you might start to worry, what if it happens again? This worry itself creates stress and anxiety, which releases hormones like adrenaline. Adrenaline constricts blood vessels, which is the exact opposite of what needs to happen for an erection. This creates a devastating self-fulfilling prophecy where the fear of failing causes the failure to happen. Broader issues like chronic stress, depression, and low self-esteem also play a huge role. When you are stressed about your job, finances, or family, your body is in a constant state of fight or flight. This is not a state that is conducive to sexual arousal. Depression can sap your energy and interest in activities you once enjoyed, including sex. It can also directly affect the brain chemicals involved in pleasure and arousal. Furthermore, feelings of guilt, whether related to sex or other issues or low self-esteem, can create mental blocks that prevent you from relaxing and becoming aroused. Relationship problems can also manifest as erectile dysfunction. Unresolved conflict, poor communication, or a lack of emotional intimacy with a partner can make it difficult to feel sexually connected and aroused. In these cases, the erectile dysfunction is a symptom of a deeper issue within the relationship. It is why treatment for psychogenic erectile dysfunction often involves counseling or therapy, either for the individual or for the couple. Addressing these underlying mental and emotional hurdles is key to breaking the cycle and restoring a healthy, confident sex life where the mind and body are working together in harmony. Sometimes, the very treatments meant to help us, like blood pressure meds or antidepressants, can cause erectile dysfunction. Don't stop your medication, but talk to your doctor about alternatives. Surgeries for prostate or bladder cancer can also have this effect. The key is open communication. Your medical team can help you find solutions. Recognizing the signs of erectile dysfunction is the first step to addressing it. The most obvious sign is a consistent inability to achieve or maintain an erection, not just a single off night. You may notice erections are less firm or fade too quickly. Pay attention to morning erections. If they decrease, it could be a clue. Recognizing these patterns helps you know when to seek help. Erectile dysfunction affects more than just the body. It deeply impacts emotions and self-esteem. Anxiety, frustration, and even depression can follow, straining relationships and daily life. Recognizing these emotional symptoms is key to understanding and addressing the full picture of ED. Deciding when to see a doctor about ED can be tough. If the problem is consistent, causes distress, or you have health risk factors, it's time to act. Don't wait for things to get worse. Seeking help early is a sign of strength and can lead to better outcomes. Taking that first step is the most important move toward feeling better. Walking into a doctor's office to talk about erectile dysfunction can feel intimidating, but knowing what to expect can help ease your anxiety. Your visit will include a conversation about your health, a physical exam, and possibly some simple lab tests. This process helps your doctor find the cause of ED and create a treatment plan to get you back on track. The most effective way to tackle erectile dysfunction often starts with your daily habits. Before considering medication, focus on the basics: diet, exercise, and quitting harmful habits. A heart-healthy diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, improves blood flow and reduces inflammation. Regular physical activity, even brisk walking for 30 minutes most days, boosts circulation and lowers blood pressure. Exercise also helps manage weight and reduces stress, both key for sexual health. Smoking damages blood vessels and quitting is crucial for erectile health. Limit alcohol, as heavy drinking can harm nerves and hormones. These lifestyle changes aren't quick fixes, but they build a strong foundation for lasting improvement. By taking charge of your habits, you're investing in your overall health and sexual vitality. Start with small, sustainable changes. Your body and your confidence will thank you. Oral medications like Viagra, sildenafil, have revolutionized ED treatment for millions. These drugs, called PDE5 inhibitors, work by enhancing your body's natural erection process during sexual arousal. They don't cause erections on their own, you still need stimulation. Options include Viagra, Cialis, Tadalafil, Levitra, Vardenafil, and Stendra, Avanafil, each with different onset times and durations. Cialis, for example, can last up to 36 hours, offering more spontaneity. These medications are generally safe but require a doctor's prescription and evaluation. They're not suitable for men taking nitrates for heart conditions due to dangerous blood pressure drops. Always consult your doctor to ensure these drugs are right for you. When used correctly, they can restore both function and confidence. Remember, medication is just one part of a comprehensive approach. Combine it with healthy habits for the best results. If oral medications aren't effective or suitable, other medical options are available. Self-injection therapy uses drugs like alprostadil, injected directly into the penis for a reliable erection. No sexual stimulation needed. Vacuum erection devices, penis pumps, use suction to draw blood into the penis, with a constriction ring to maintain the erection. Both methods are safe, effective, and can be used at home. For severe cases, penile implants offer a permanent solution with high satisfaction rates. Implants involve a surgical procedure to place inflatable or malleable rods inside the penis. Inflatable implants allow for a natural feeling erection at the push of a discrete pump. Your doctor can help you choose the best option based on your needs and lifestyle. Don't lose hope. There's a solution for nearly every situation. The goal is a satisfying, reliable sex life tailored to you. Treating ED isn't just about the body, it's about the mind too. Psychological factors like stress, anxiety, or depression can cause or worsen ED. Therapy, especially cognitive behavioral therapy, CBT, helps break the cycle of performance anxiety and negative thinking. Couples counseling can improve communication, reduce blame, and strengthen intimacy. A therapist provides tools to manage stress and rebuild self-esteem. Even if you're using medical treatments, mental health support can boost your results. Addressing both physical and emotional aspects leads to a more complete recovery. Don't hesitate to seek help. Mental well-being is key to sexual health. Combining therapy with other treatments often yields the best outcomes. Restore confidence, connection, and quality of life by caring for your mind as well as your body. ED affects both partners, making teamwork and communication essential. Open, honest conversations without blame help both people share their feelings and concerns. A supportive partner can encourage doctor visits, join in healthy lifestyle changes, and help create a relaxed environment for trying treatments. Working together turns ED from a personal issue into a shared challenge. Intimacy isn't just about intercourse. Explore other ways to connect physically and emotionally. Touch, massage, and affection can reduce pressure and performance anxiety. This shift often helps erections return naturally. Facing ED as a team can deepen your relationship and resilience. Remember, you're not alone. Support makes the journey easier. Together, you can build a stronger, more communicative partnership. Prevention is the best strategy for erectile dysfunction. Healthy habits, balanced diet, regular exercise, and weight management protect your blood vessels and nerves. Manage stress with exercise, meditation, or time in nature. Prioritize quality sleep to support hormone balance and recovery. Avoid smoking and limit alcohol to reduce risk. Regular checkups help catch and manage health issues early. Treat conditions like high blood pressure or diabetes promptly to prevent ED. Your sexual health reflects your overall health. Care for your body as a whole. Small, consistent choices today lead to long-term vitality. Invest in your well-being now for a satisfying, active sex life in the future. If you're experiencing erectile dysfunction, you are not alone. It's a common, treatable health issue that affects millions of men from all walks of life. ED can be an early warning sign for other health conditions, especially those related to your heart. There are many effective treatments and lifestyle changes available. Remember, real hope and solutions are within your reach. Erectile dysfunction is often surrounded by silence and outdated ideas about masculinity, but breaking that silence starts with you. Honest conversations, with your partner, a friend, or your doctor, can turn anxiety into a manageable problem. Facing ED can inspire positive changes like quitting smoking, eating better, or exercising. These steps improve your health, energy, and relationships, leading to a more vibrant life. There is real hope for overcoming erectile dysfunction. Science has advanced, and most men who seek help find solutions that work. Take action. Reach out to your doctor. Every small, healthy choice is a step toward a more confident, vital you. Your health is your greatest asset and you are worth the effort.